Assalamu alaikum everyone, it's Yaman Alassaf, and today inshallah we will be seeing the second lecture of embryology in CVP, the formation of heart chambers and its defects. So let's start. So just a review from the last session, we took the endocardial tube and how each part of it will give like a part of the future heart. So for example, for the right atrium, we'll be getting it from the sinus venosus and the primitive atrium. And also you have to know that for the left ventricle, the left atrium, we'll be getting it from the pulmonary vein, and like a really small part of it will come from the primitive atrium, but like mainly it's from the primitive from the pulmonary vein. Okay. So as we all know, we have four chambers, the right and left atrium and right and left ventricle. So today we will be seeing how we got like these four parts, because when the folding starts and the endocardial tube starts folding, there will be like no there will be like no septum, or there will be like the heart will be not divided into four parts. It will be like a circle, so there's not really like a right part or the left part or like a ventricle or an atrium. That's why in today's lecture we will be seeing how we'll be getting like the septums, the interatrial septum, the interventricular septum, and that will cause the heart to be divided into like these four parts. Okay. So let's start with the development of interatrial septum. First of all, we have here like the right atrium and the left atrium. So the interatrial septum starts with the septum primum, which is the first septum to exist, and it starts growing from this part, which is called the endocardial cushion. Okay, so this is the endocardial cushion. Then it will start going and down and leaving this part till it hits this wall. Okay, and this part, which is like empty, you have to know that its name, which is the ostium primum. Okay, it's the ostium primum. Then also you have to know that during fetal life, the pressure in the right atrium is way more higher than the pressure in the left atrium. So that's why the blood will start going like this from the right atrium into the left atrium directly. Then when it hits and goes down, okay, this is the the septum primum. Okay, it will leave like an empty place here, and the blood will start going from up. And this empty place this time is called the ostium secundum, the second one. Okay, ostium secundum. And finally, there will be like a septum secundum, which will start like growing before the septum primum, and we will be getting like an empty place here called the foramen ovale, which is open during fetal life. It's open during the fetal life, but during the like when the baby after birth, the foramen ovale will close, and it will be called the fossa ovalis, which what we took in the anatomy sessions. Okay, and we will be seeing how the foramen ovale will close, but you have to know that there's the septum primum, the septum secundum. This part, or this empty part, is called the ostium secundum, and between them we will be getting the foramen ovale, from where the blood will start going from the right atrium, okay, to the left atrium. Then just to show you like an image, like summarizing everything, that's the right atrium, and that's the left atrium, and here we have the septum primum, which will go from up to down, and it will leave this part, like this empty part, which is called the ostium secundum, and here we have the foramen ovale, and that's the septum secundum. Yes. And from here, from the foramen ovale, the blood will go from the right atrium to the left atrium. And that's it for the interatrial septum. That's all you have to know. But you should like check the transcriptions, and you should see like the recording with Dr. Paul, because it's not really enough to ace to ace embryology in CVP. Then now we will be seeing how the foramen ovale will close. Excuse me for this mistake, it's with the A, okay? So after the birth, the foramen ovale will close, but how it will close exactly? So when the baby starts crying, he will take his first breath. So when he takes his first breath, the left atrium, or the pressure in the left atrium, as we took before, it will be the pressure in the left atrium is like it's really down. Okay, so then when he takes his first breath, the pressure will start going up, and it will increase. So with this high pressure, the pulmonary vein, due to the pulmonary vein circulation, the foramen ovale will close. How? The septum primum will hit the septum secundum. So, for example, if you got a question, what causes the foramen ovale to close? It's mainly it's not mainly. It's the septum primum hitting the septum secundum. So, if he give you, for example, a tricky option, which is the septum secundum hits the septum primum. No, it's not the septum secundum, it's the septum primum, the one on the right, okay? That will hit this part, okay? So the septum primum hitting the septum secundum. And that's it for the interatrial septum. So now we'll be seeing the interventricular septum, which is way easier than the interatrial septum. All you have to know that there's just two parts, or two regions in the interventricular septum. So these two regions are the membranous region and muscular region. So this part is the membranous region, and the 2/3 of it will be the muscular region. So you can say that this part and like a big part here will be, so this is the muscular one, and this one is the membranous one. Okay, so as we all know, the membranous one will be most likely more easier to break than the muscular part, and that will cause some problem that we will be seeing in the congenital diseases after. Okay. And finally, the third septum, which is the aorticopulmonary septum. All you have to know for this septum is that the aorta and the pulmonary artery will start fusing and will turn. Okay, so when they turn, all you have to know that it will turn because the aorta, before turning, it will be on the right ventricle. So to go to the left ventricle, it will start turning. So the left ventricle pumps into the aorta, and the right ventricle pumps into the pulmonary artery, and that will give us the aorticopulmonary septum. So, for example, if the aorta and the pulmonary artery don't turn, that will cause a problem because the pulmonary artery will be on the left ventricular side. So the left ventricle will start pumping into the pulmonary artery, and the right ventricle will start pumping into the aorta. That's one of the congenital diseases. Okay. And now let's go to the second part of this lecture, which is just 2 slides and really easy to know. And we'll be starting with the congenital diseases. The first one, the ventricular septal defect. You have to know this, and it came many times in the past questions. You have that the ventricular septal defect is the most common congenital disease. It's the most common. So if he asks you, for example, what's the most common congenital disease, you have to choose the ventricular septal defect. It's not a tetralogy of Fallot, it's not any problem, it's just the ventricular septal defect. You have to choose this, okay? And for this, the left ventricle, in this problem, the membranous part will be broken. So the blood will start going from the left ventricle into the right ventricle, and that's all you have to know. Okay. Then finally, with the last slide, which is the tetralogy of Fallot, you have to know for this problem, or for this disease. You have to know that the main cause for this defect is the neural crest defect. It's the neural crest defect. So if he asks you, if he give you in the options what causes the tetralogy of Fallot, it's the problem of a neural crest. It's a neural crest defect. It's not the overriding of aorta or anything of these. These are problems in the tetralogy of Fallot, but it's not the main cause. Okay. So we'll be seeing these four problems here. When in the tragedy of Farat, we'll be getting the overriding of aorta. So the aorta will be bigger and it will take the place of the pulmonary artery. So when it will take the place of the pulmonary artery, we'll be getting the pulmonary stenosis, because it's like way more smaller than it should be. And because the overriding of aorta is going like toward the right, that will cause a ventricular septal defect on the membranous part. The right ventricle will start like pumping into the aorta, and the left ventricle also. That will cause the fourth problem, the right ventricular hypertrophy, because we'll be getting more blood and we will be getting a high pressure. So we will need more muscles, and that's why we'll be getting a right ventricular hypertrophy. So just to repeat fastly, it will start with the overriding of aorta, going towards the right and getting bigger. So when it gets bigger, it will take the place of the pulmonary artery. So we'll be getting the pulmonary stenosis. It's smaller. Then because it went towards the right, you have to see like that. That's for the up part, and for down on the ventricular like sides, we'll be getting two problems: the ventricular septal defect on the membranous part, because the aorta goes towards the right ventricle, and because there's more pressure and there's more blood going into the right ventricle, and the right ventricle is trying to pump into the aorta. That's why we'll be getting a right ventricular hypertrophy. Okay, and I guess that's it for today's lecture, and merci.